If you have a swelling on your body, the first question you will be asking, or the first apprehension you will be having, is it a cancer? Let me explain to you, is this cancer or not? The basic purpose of all living organisms, starting from the single cell organism to multicellular organisms like a human body, the purpose is to survive. So when there is a survival purpose, the cells which are making the entire human body, they keep on dividing, multiplying, and healing and repair is a basic mechanism for health and happiness, or for the health of the human body. So when they divide it and multiply, there may be formation of small swellings in the human body. Naturally, there will be lot of divisions. For example, in the blood, there will be called as red blood cells. They multiply and they die at the end of 120 days, and the new cells will be formed. Similarly, when there is an external injury, it could be a physical injury, it could be a chemical injury in the form of smoke. For example, for the smokers, there will be a lot of smoke going into the lungs, and that injury and that repeated injury will cause some tumors. And also it could be some sort of mental or basically due to stress and tension. Also, there will be a lot of cellular injuries. These cellular injuries will create advanced or enhanced multiplication of the cells, and these multiplication of the cells will appear like small swellings on the human body. Now let me tell you what are these simple or benign swellings, or malignant or cancerous swellings, or the dangerous swellings. The simple swellings are well defined, they are capsulated, and they do not undergo any extension beyond their capsule. They do not extend into the adjacent organs, and they do not extend into the rest of the body. Whereas the dangerous or cancerous swellings will extend beyond the organ, and they will spread into the brain, they will spread into the lungs, they will spread into the bones, or everywhere they will spread, and that will cause a lot of problem to the human body. Now let me tell you how to differentiate whether these tumors are dangerous or non-dangerous, and it may ask for a biopsy. What is a biopsy? Biopsy is putting a needle inside this particular tumor, taking some cells and examining under microscope to find out whether they are cancerous or not. But there are advantages as well as disadvantages in these particular biopsy. In a benign cell or in a simple cell, the body would have made so many mechanisms, there are so many immune mechanisms or defense mechanisms to contain all the malignant cells, all the dangerous cells inside a particular wall or inside a particular what is called as a capsule. The capsule is a hallmark of simple swellings, whereas in dangerous swellings or cancerous swellings, there is no capsule. Now, when you do a biopsy, you will be putting a needle inside, and you'll be opening that capsule, and you may be allowing the cells to spread into the entire human body. So you should be very careful before doing a biopsy. In that case, you may be asking me whether it is possible to evaluate these tumors without putting a needle. As a radiologist, or as a radiologist seeing all these swellings over a period of 25 years, doing almost 200 scans per month, I would like to say the biopsy is not necessary, and modern AI-driven tests like X-ray, ultrasound, CT scan, MRI will tell you whether this particular tumor is dangerous or non-dangerous. Let's say if there is a big tumor, then you can see the capsule and say that this is within the capsule and it has got a very less potential to spread. And if there is a small tumor, the other hallmarks of all these tumors, or malignant or cancerous or dangerous tumors, is to have lot of vascularity. They will have increased vascularity. They will also show much more cellularity, and they also grow very fast. So these are the three things which are very important when you see a small tumor. So magnetic resonance imaging, what we do to study these tumors, will tell you whether it is cancerous, whether it has got a capsule, whether it has got increased vascularity, whether it has got more cellularity. These are the things which you can do by doing magnetic resonance enhancement studies. So in this case, you can definitely differentiate whether it is a simple tumor or a malignant tumor. Whereas if you do a biopsy, you will be breaking the wall and you will be breaking this particular defense mechanism of the human body and making these cells to extend into other parts and also into the distant parts of the body like the liver, brain, tissues. So what I would like to say is without biopsy, you can analyze as much as possible. The most important feature of these dangerous tumors is to multiply very fast. So what we see is a doubling time. If these tumors are doubling their size, then you can say within 3 months, then you can say it is a cancerous. Ultimately, what we divide these tumors into good, bad and ugly. Good tumors which is a well-defined capsule and it looks non-dangerous, we leave it alone. Bad tumors, you would like to follow it every 3 months. If it is increasing in size, definitely you would like to remove this without doing any biopsy. Ugly tumors which are already do not have a capsule, which have spread everywhere, then immediately you remove these tumors. Finally, friends, we should know what is the cause for all these tumors. I told you the physical injury, chemical injury, and more than that, the mental injury is the most important cause for all cancers. So you should work with love and affection. You should respect everybody. The moment you love each and every work, the moment you enjoy your work, you will come out of your tension and you will understand what is happening, and the cell division also will be restricted and formation of the tumors will be very, very less. And the most important, I would like to tell you, work with love and affection. And even then, if you have a tumor, you should go and work in a place where it is a government hospital, where there are cancerous patients, children having cancer. Spend some time with them. Definitely you will see, you will get a lot of solace, a lot of comfort, a lot of health. So basically, the purpose of life is to live with love, affection and happiness forever. So if you come out of this stress and tension, definitely you will avoid most of the cancers. Thank you very much.